Hello and welcome everybody, Nurse Hack for Health. We are Team Nightingale. We are looking to help reduce nurse burnout through the collection and aggregation of data. So what is the problem with nurse burnout? Let's hear a story from Sharonda.
After 15 years of nursing, I just didn't want to go to work anymore. I was exhausted, uninterested, and I no longer wanted to be a nurse. I had to take a drink just to go to sleep at night. I thought I was depressed. Actually, I was burnt out. Turns out I wasn't alone.
And things have especially become worse with the COVID-19 pandemic. Up to 83% of nurses are fatigued, 64% feel that they are currently experiencing burnout in their job, and replacing a nurse can cost an organization anywhere between $40,000 and $64,000 a year. How are we going to help this? We are going to look at a three-pronged approach here. Next slide, please. We are going to use cloud-based software, which can be available on a website or on a phone app, that allows us to assess the nurse, help reset, and help reaffirm the nurse. Next slide, please. As we look at this, step one is the critical part. This is using the app or the website in about 2 minutes at the beginning of their shift, somewhere in the middle, and at the end of the shift, and possibly even on their days off. We're going to look at them from a physiological and a psychological and an environmental perspective. Are they receiving the help they need throughout the shift? Are they in pain? Have they been able to use the bathroom today? We are going to collect this data, make it anonymous, and then present it to the facility in which they work so that they can understand where the shortcomings are in the various specific units like ICU, MedTele, etc., to help the organizations drive positive change for their nurses. Next slide. Step two is where we help reset the nurse with meditation, deep breathing, stretching exercises, provide suggestions for them. Next slide. Step three is where we reaffirm the nurse, help them understand that they are doing a good job and providing quality care. Next slide.
Nightingale looks to make changes on different levels. From the micro level, it offers a safe place for the nurses to feel safe, calm, and heard. From a macro level, it helps the organization find solutions with the data collected. Together, it helps promote a better environment to prevent burnout. Next slide. Nightingale is currently a disruptor in both the data collection and nursing-centered resilience centers. We believe this app can truly improve nursing with a gradual adaptation that's not just a temporary fix. Next slide. The scalability of Nightingale extends the more it's adapted by different levels. At the individual level, nurses reap the reward of lessening burnout. At the group experience, scores can be compared between hospital units to identify best leadership practices within the organization. And then at the systems level, researchers can use the anonymized data to make discoveries about the whole nursing field and how we can change that. Next slide. There are many ways to expand the application for a more holistic application going forward. This is the different parts in which we can expand to make it more adaptable to nurses in different situations. Next slide.
3 minutes.
Opportunity to implement the software with current partners in health. It could save the organization about $40,000, $64,000 for each nurse saved from burnout. Next slide. Why is this called Nightingale? Because we want to carry out the legacy of Florence Nightingale herself by improving the environment in which nurses practice. Next slide. Our team is eager to innovate for a healthier and brighter nursing future.
Thank you.